My name is Sonia Briggs. I joined the Health Board in 1992 following qualification as a registered nurse. I started work in a ward and went on to the dizzy heights of head nursing some years later, and worked in Glangwili, which was a learning curve for me in that role. From there I moved into workforce and had a very enjoyable 2 years with workforce, looking at different projects and different ways of working. When COVID came, I moved into Bluestone and into occupational health and worked through those two departments, plus some workforce roles, and gained hugely from that time period. I then became the Band 7 here in the archives as a lead vaccinating supervisor. So I've been doing that since last March. In terms of the military, I joined the military in 2004. I joined the RAF Reserves. I joined specifically because my son had been deployed to Iraq in 2003 as a paramedic and was working there. At the time I decided to join. The decision was made very much because I wanted to help people, and I felt that my clinical skills in the NHS would support that, and indeed it did when I was deployed then to Afghanistan some time later. I've enjoyed working for the Health Board. The Health Board's given me management and leadership skills, governance skills. I do a lot in terms of competence assessment in the RAF, so the roles gel together very much. Obviously the clinical nursing skills are kept up to date because I am working with the military and I am called upon to use those. And it's worked really well. The Health Board has supported me throughout this last 18 years in terms of time off, the 2 weeks time off to complete annual training, which is mandatory with the military, but also in terms of day-to-day supervision and support. What I've learned in the Health Board has been transferable to the RAF, so in terms of supporting my colleagues, working collegially with people and other disciplines in the military has been hugely beneficial